Welcome, parents, athletes, coaches. I am here with Dr. Jason Smith, physiatrist here at Atlantic Health, home of Atlantic Sports Health. And today we're going to talk about disc bulge, and such a common injury that not only athletes have, but the everyday layman. It occurs to poor posture. But Dr. Smith, tell us a little bit about your background, how you got here at Atlantic Health, and I'm sure you see a lot of patients with this issue.
Sure. So myself, I did my training in New Jersey Medical School in Newark, New Jersey. From there, I went on to do specialty training in physical medicine and rehabilitation at JFK Johnson Rehab Institute in Edison, New Jersey. Went on to therefore subspecialize in interventional spine and sports in coordinated health in Lehigh Valley, Pennsylvania, and was out there for about 3 to 4 years. And once there, an opportunity arose for me to join the Atlantic Medical System family, and it was a wonderful opportunity. Myself and my wife were both from New Jersey, so it was a nice chance to come back home. And so, here I am.
That's great. That's great. Well, welcome. And I know we have our great model. Talk to us about the disc bulge.
Sure.
Why does it occur, and what's happening, and how do we prevent it?
Okay, sure. So the disc bulge is probably the most common pathology that you're going to have in a back, particularly in the lower back, the lumbar spine, as we like to call that area. What causes it? There's a wide variety of causes for it. The most common is life, just living. As long as you keep aging, you're going to eventually get a form of a disc bulge. Now, that doesn't always mean that you have to have pain from it, but it will come. But, however, there are certain scenarios that can increase your probability of getting one, or even increase the frequency of you having discomfort from having a disc bulge, and even increasing that bulge to eventually a herniation and possibly even what we call an extrusion or a fragment. Mm-hmm. So that usually comes from when we put a lot of pressure on our lower back. Okay? As we know, unless you're laying flat down on your back, your lumbar spine or your lower back will always have some form of pressure on it. And the two lowest levels are really the two areas that tend to get beat up. Yep. So, especially for our athletes, when they do a lot of heavy repetitive motions, whether it's been the training room or in their sport of choice, they consistently put a very high velocity and high traction on their lower back, and they do it over and over and over again. And while they are physically fit, in great condition, it's still going to continuously wear down on that area and put them at high risk for that.
Yeah.
So.
What's interesting, I think, we have a little model here, our trusty model, and to give people an understanding. I mean, when you look at the discs themselves, right? I mean, it consists of the annulus fibrosus, which is the collagen tissue that separates the two vertebrae, right? So the vertebrae are more like bricks, I like to kind of describe them as, and then this collagen tissue holds in this material, the nucleus pulposus. I think I got that right,
yeah,
right?
You got it right.
And the important thing is when we have bad posture, it seems like this slowly delaminates.
You're correct.
And there's a challenge, and with bad posture or improper lifting technique, a lot of times athletes will promote this injury when they're doing the wrong things. And what would you say to parents out there? What would you say to people out there about good spine hygiene and the importance of keeping this healthy? Because that's really the bottom line. You said, aging is we can't fight that, right?
Correct.
We're all going to age, but we can slow it down.
Correct.
So what would be some recommendations?
Stretching is vital. Stretching is vital. I like to also sometimes talk to my patients about inversion table therapy or teeter-totter therapy to sometimes give a little bit of traction to that back to really kind of help stretch it out. I am very big on yoga and Pilates, for working the core. It's a very low-impact exercise that can really help stretch the spine, really keep a nice amount of moisture within those discs. When patients get imaging and they have that very common term, degenerative disc disease. It's my job to educate the patients, and I let them know, like, this is something that everybody will get, okay? And basically what it utilizes is that as we age, as we put our back through repetitive trauma, we start to lose a little bit of water out of that disc, and that's really how you start to kind of get that out pocketing a little bit, get that disc bulge. So, really trying to pull it apart a little bit really
Yeah.
helps to kind of keep it going. Even doing exercises in the pool,
Right.
is really beneficial. Just the buoyancy of water, giving your body a little bit of weightlessness,
Sure.
really helps
Sure.
as far as going forward with that. So.
I think that's an interesting point. You talked about yoga, and from the research I've done, obviously there's some benefit to yoga, but also I think what's important to understand, depending on the type of athlete you are, right? I mean, so I think core stiffening and stabilization, creating those guy wires, right,
Correct.
around the core, and creating a stable core to hold that posture together and keep that spine healthy, because yoga in some ways will be good for some individuals, but also
Correct.
in some other individuals that need to be explosive might be a detriment.
Correct. And-
So I'm sorry, go ahead.
And so that's why, piggybacking off with what you just said, and I appreciate you saying that, I like to always have my therapist involved as well,
Yeah.
because you're correct. Sometimes what will work for one person may not be a benefit to another.
Right.
I always approach a patient with nobody's a cookie cutter.
Right.
Okay. So it's, each set of rehabilitation needs to be individualized for the patient.
Yep.
To see what they can use and utilize.
Yeah.
For them. So you're correct.
Well, I think it's so important, and I think the takeaway here with Dr. Smith is that individualization is so critical. That's why it's important to get expert advice from someone like Dr. Smith here at Atlantic Health, and understand where you need help. I mean, is yoga the right solution? And I think for many adults it very well could be. And for some athletes, based on their spine type, because we know different athletes or different people have different types of spines, right?
Yes.
Some people have more of a log of a spine. Some people have more of a wire,
Correct.
right? And as a athlete, say a golfer, you want to be more of a wire. And if you train to be like a log, well, guess what? Your golf game is going to get challenged.
Yes.
If you train too much with weights and whatnot. But in any event, really important information. This has been great. Hopefully, for all the viewers, you kind of get a sense that it's important to understand spine hygiene, spine health. We understand it's important to stay healthy and take advantage of flexibility exercises at the same time, building stability. Thanks so much for being
you.
on today, Dr. Smith.